mobilization? Okay, so the patella moves when the knee joint moves. Okay, so when your knee goes into extension, which way does the patella move? Superior. And when your knee goes into flexion? Inferior. Inferior. So to get the patient comfortable, you're going to put a pillow underneath their knee. So their knee is just slightly flexed. And you really have to make sure their quads are off. Quads are a very, very strong muscle. If he turns his quad on even just a little bit, I'm not going to be able to move his patella. So you have to make sure he's comfortable and relaxed. Okay, now the patella can move 360. So in general, what you're going to do is see how it moves medial lateral, and then see how it moves superior inferior. Okay, now you can be more specific with your fingers, but what's going to be more comfortable for the patient and give you more force is if you literally surround the patella. So you can get the skin out of the way, lock in there, and then I just have to move my body and his patella goes with me.
You can push down.
You're not pushing down.
Oh, okay.
I'm on each side because I'm around the patella. And then I shift this way and it pushes up. Shift this way and it pushes down. And then same thing, this way medial, this way lateral. Okay, now again, where are usually most of the adhesions if someone is adhered?
Lateral.
Lateral. So you may feel, depending on who you're working with, that it's more difficult to push medial. Sometimes people are so adhered, their patella is actually shifted laterally. So when you try to move it medial, it's not going anywhere because it's already at the end of its range. Okay? Which for him, there's a little bit of movement lateral, and it's resisted motion medially. Okay? Because it's tight over here. Okay? So if we do it a few times, it can loosen up. Okay? So you're going to go to the patella, move it inferior, superior, and feel medial, lateral, and feel where there's some adhesion. Sometimes it'll go, and then his actually has not. But eventually, if you do it enough, that stuff will break up, and it won't do it again. Okay, so now let's start facilitating improved extension. Okay, so if a patient is lacking full genu extension or full genuflexion, it may not be the femoral tibial joint, it may be the patellofemoral joint is not moving. Okay, so again, if we're going to go into extension, which way do we want the patella to move? Superior. Okay, so I'm going to get my hand ready to push the patella superior as I bring him into extension. So I'm going to push up as I go into extension. Okay, and it's just a small range, but we're working on that end range extension.
So is that grade 2?
It's not a true mobilization. So we don't do the same sort of grade.
Do you ask him to fire the quad?
Nope, because the quads will turn on and essentially hold the patella in place if it's not gliding properly in the first place. Okay, so this, again, this is completely passive. Yeah, because if his patella is stuck in an abnormal place and he turns the quads on, the quads aren't going to move the patella. They're just... Okay, and again, we need him to be relaxed. So as we go into flexion, which way do we want the patella to move?
Inferior.
Okay, so he's not relaxed. There we go. Make your leg nice and heavy. You can put your arms on your side. Sit back on your arms.
Want a beer?
Sin service.
Yes, I do.
Okay, so I can just move my leg and have him go into a little bit of flexion. Okay, so I've got him supported, so he feels comfortable. Okay, but if I move my foot, I can help him drop into flexion. Now eventually, if he's comfortable enough, we can do a little bit more here in a different range. So I am pushing the patella inferior as we go into flexion.
And you don't want to go past 90 degrees?
I'm going a little past.
God, get a picture of this.
Okay, so you start here, make sure they're relaxed. Okay, where I'm moving his leg. Okay, and then drop it into a larger range. And same thing. So I'm pushing down as I push back. Okay. Okay. Now practice that, and then I'll show you one other technique.